Okay, Sean, I think we're good to start. Whenever you're ready, please take it away.
Sure. We are OActive, a group of passionate medical students who want to revolutionize the care of osteoarthritis by blending technology with pre-existing health solutions to further increase the efficacy of healthcare delivery. How many of you have heard your aging parents complain of joint pain or reduced mobility? Chances are that they are among the 150,000 elderly who have osteoarthritis today. When you step into their shoes 30 years later, this number is expected to balloon to more than 425,000 by 2050. Something needs to be done. Let me tell you a story about Madam Tan, a retired 70-year-old grandmother. Madam Tan has knee OA and has long relied on painkillers for symptomatic relief during her flare-ups. Over time, this creates a vicious cycle of increasing painkiller use, resulting in adverse side effects such as kidney injury. Madam Tan is considering joint replacement surgery next. However, such procedures are costly, with fees averaging $53,000 in the private sector for a bilateral knee replacement. An average worker with a salary of $4,500 will need to work for a whole year to afford this surgery. Clearly, Madam Tan is not keen on surgery. The physiotherapy center is a few bus stops away, and she'd much rather exercise at home. But how do we know if she's exercising correctly? What if she falls and no one knows? On her last visit to a physiotherapist at the polyclinic, she was introduced to a product that solved all her problems. Introducing OActive. OActive consists of an app which links to an AI-based motion sensor that can detect movements when elderly patients exercise. The app is kept simple to increase user friendliness. Madam Tan will only need to click between the two big buttons shown on the screen. This convenience extends to the sensor, which she can easily link to her TV through a one-time setup. Madam Tan is now beginning her first exercise. The game involves her copying the position shown to get through the hole in the wall. This trains her target muscle groups while ensuring that she remains engaged through trying to score in the game. In the next game, Madam Tan raises her legs to 45 degrees when the game requires her to raise it to 90 degrees instead. The AI algorithm detects this postural error and corrects her in real time via verbal and visual prompts through the avatar. Madam Tan will still receive the same level of individualized guidance as a normal physiotherapy session from the comfort of her own home. Madam Tan's safety is our utmost priority. Our device's built-in fall detection system will flash an alarm prompt which Madam Tan needs to reset in the case of a false alarm. In the app, if the app senses no user input to her phone for more than 5 minutes, her emergency contact will immediately be notified. At the end of the month, a diagnostic report will be sent to Madam Tan's physio, who will assess her progress. If the physio finds that she needs more specialized help, the physio will contact her for in-person physiotherapy sessions. Surveys showed that motivation is often the main roadblock for compliance to OA treatment. Hence, our app uses a rewards-based system. Through completing her home exercises, Madam Tan has now earned 1,300 points. She can redeem them for coupons from our partner companies such as NTUC. The more compliant she is, the more points she earns, and the more coupons she can redeem. The app will also be available in the 4 official languages, with all exercise videos adapted accordingly to cater to Madam Tan's linguistic needs. Videos will be approved by physiotherapists and GPs to ensure factually accurate content is being presented. OActive ultimately aims to provide Madam Tan a safe, reliable, and effective way to manage her OA. Our OActive sensor makes use of a color camera and infrared time-of-flight depth sensor. Both work in tandem to create a 3D map of Madam Tan's movements and posture. Any deviations from the appropriate posture during the exercise will be picked up by the AI system and recorded. Our sensor has an AI chip to allow for edge computing, which would decrease cloud traffic and resultantly decrease cloud computing costs. The AI technology will be based on existing AI training datasets, with further fine-tuning done through assessing the posture of OA patients by our partner physiotherapists. This not only grants access to a much larger sample size of AI data to improve machine learning, but also provides OActive with data that is specific to the needs of OA patients. There is massive market potential with our solution due to the large and growing population of elderly OA patients, estimated at 425,000 by 2050. OActive targets those with TVs and smartphones to assess our full suite of services. A 2020 study showed that 56% of elderly have smartphones, with the percentage only increasing. Therefore, conservative estimates still places our SAM above 238,000 by then. We hope to capture patients who are compliant to current treatments, as our products would most likely bring them the most benefits. Our research shows that 56% of patients were compliant to their OA therapy, which gives us an obtainable market of over 133,000. Madam Tan would fall into this category. Beyond Singapore, we eventually aim to expand to similarly advanced East Asian markets like South Korea, Japan, Taiwan, and Hong Kong, expanding our potential market significantly. Our business model is mainly centered around the B2G avenue, such as public hospitals and polyclinics. This is to ensure the uptake of new technologies while also maximizing exposure to the public of our product. In addition, we will target B2Bs, such as nursing homes, as well as B2B2Cs, such as major pharmacies like Watsons and private GPs. Based on surveys conducted with patients, the average cost of physiotherapy is $20 per session, costing up to $80 monthly. Current sensor technologies have a high barrier to entry, with a retail price of almost $400. Our sensor costs only $299. An optional $10 monthly subscription fee unlocks OActive Plus, which unlocks more exercises and generates reports, which can be sent to their care team, updating them on their physio progress. Madam Tan will require less frequent in-person physio follow-ups if she is compliant, decreasing her overall treatment costs. As a retiree, perhaps Madam Tan finds it daunting to spend $299 on our product initially. Fortunately, she can pay via installment plan over 24 months, having her pay a total of only $22.50 a month with OActive, compared to $80 a month with current treatments. That saves her roughly $57.50 a month. So let's say Madam Tan is keen on telerehab. Why would she choose OActive over those already in the market? Firstly, this device does not require the use of wearable sensors. She will not have to struggle with putting on the sensors before each session. This increases convenience and compliance. Secondly, Madam Tan will not have to buy a tablet just so she can access telerehab. She can simply turn on her TV and begin. Lastly, current telerehab services use real-time physiotherapy monitoring, but OActive's AI technology guides the patient instead. Beyond Madam Tan, the broader healthcare system, benefits in this optimization of limited manpower, which ultimately helps stem rising healthcare costs. Here is a graph illustrating how OActive stacks up against our potential competitors in the market. Madam Tan is now happy, but what about us? Our projections are based off an average of 1 year compliance to our subscription service in a 75-25 split in favor of OActive Plus. Based on these preliminary assumptions, our average revenue per customer is $389, with our estimated cost of production being $150. This gives us an initial profit per customer of $239. However, as we expand and gain market share, this cost is expected to drop significantly as we reap economies of scale. This will inadvertently increase our profits per customer as our user base grows. Advertising is the first mode of profitability in our profit model. Potential clients include corporations catering to the elderly, such as pharmaceutical firms, health wellness brands, private doctors, or private physiotherapists. Businesses like supermarkets, convenience stores, or wellness chains can become partners by paying a partnership fee. Hospitals can also pay a licensing fee to use our devices for their patients. Our interviews with stakeholders, namely patients, orthopedic surgeons, GPs, and PTs, revealed that most of them are receptive towards OActive, with 8 out of 10 of them saying they will use it. By the 6th month, we aim to reach out to doctors, physiotherapists, patients, and healthcare administrators. The main intention is to improve on meeting our customers' needs as well as scouting for potential distributors of our product. We aim to secure a proof of concept grant to enable us to develop our prototype. After the 18th month, we will work on product development, conducting rigorous clinical trials in preparation for HSA approval and filing for a provisional patent. We will also pitch for seed funding to fund our operations. At the 24th month, our product will be submitted for HSA approval. While waiting for that outcome, we will begin sourcing from manufacturers and begin our pre-marketing campaigns with our customers. The most notable checkpoint of our roadmap will be at the 30th month, where we aim to get HSA approval. We will then begin the manufacturing and test launch of our product and apply for a PCT. In summary, our goal is to launch our product within 3 years. So in summary, OActive provides an integrated system which centers around collaborating with healthcare professionals, patient education, continuity of care, and a rewards-based system. This tackles the problem comprehensively and can even be extended to other rehab conditions. So, what are you waiting for? Osteo, try this product to find out more. Thank you. All right, so to the audience there, while you're deliberating your questions, may I invite you to scan the QR code to view our prototype that we have created kindly for you to see what Madam Tan experiences. Yeah, thank you very much.
Yeah, thank you, OActive, for your presentation. We will give the judges some time to deliberate their questions. Actually, I see some questions in the Q&A chat already. Let me bring them on stage. Okay, we have the first question from Mr. Lai Feng on one of the points that you brought up during your presentation on whether it's is it generalizable or justifiable to use the medium wage to make a point?
Okay, so yeah, that's a very good point, Mr. Lai. So yes, it's true that for the $53,000, that is the private sector's rate, free of any form of government intervention or government subsidies. But even so, for the public fee for our total knee replacement, our team did some background search, and we find that the cost is still in the low five figures of about $11,000 to $12,000, which is still very significant for the elderly population as well. So we use median wage as a benchmark because we realize that our customers might come from a diverse range of socioeconomic backgrounds as well. So I hope that answers your question, Mr. Lai.
All right. Okay. Let's move on to the next question from Dr. Chen. So what's the team's strategy against expansion of competitor products such as the Nintendo Switch Ring Fit as well as some other products?
Hi, my name is Darren. I can take this question. So in comparison to so thank you, Dr. Chan, for this question. So in comparison to products such as Nintendo Switch Ring Fit or Wii Fit, I think in comparison to our product, we're trying to come up with a way that doesn't actually require anything that's wearable sensors or any other additional products that the elderly might need to use. So for example, for OActive, we're basically using a motion sensor. So in that case, we kind of try to make it as user-friendly as possible so that because we understand that maybe for the elderly, they might be familiar with technology, but may not be that tech savvy as well. So in that case, then we're trying to come up with a product that's actually very user-friendly for them so that they don't have to go through the hassle of trying to fit certain products, or then in that case, we're also trying to make the interface as user-friendly as possible. So that's kind of when it comes to our app, we only have two big buttons because we're trying to streamline what our app can provide, which is just basically the exercises and the videos that comes with it.
Yeah, thank you, Darren, for the response. Let's move on to the next question from Mr. Lai as well. Yeah, I've shown the question on stage. So how do you plan to compete with other giants doing addressing a similar problem?
Okay, I can take this as well. So thank you, Lai, for your question. So with regards to the IHIS part, right, I assume that would be the smart tele rehab you're referring to. So actually, we kind of did a bit of research for the smart tele rehab, and then from what we actually kind of did a comparison. Maybe Sean can pull up that slide.
Sure, give me a moment. Yeah. So this is the slide, is it, Darren?
Yeah.
Okay, so you can see.
So
let me put it up. Yeah. Here you go.
Yeah. Okay, so for example, when we were talking about the user friend, we were comparing to our competitors. One of our competitors that we talked about was actually the Smart Health Tele Rehab. So in terms of affordability, in comparison to Smart Health Tele Rehab, we are trying to kind of come up with a solution that's a lot cheaper than theirs because we understand from their kit that they will also require the use of an iPad. And the current market rates for cheaper versions of iPad would really be an upwards of $499, and then that's not including the price of possibly other sensors that might come in with the products as well. And then furthermore, in competition with user friendliness, we also, as mentioned before for the previous question, we're just trying to take away the use of wearable sensors because from what we understand for smart tele rehab is that they use sensors, but then there's always the the risk of what if the elderly doesn't attach it properly, then they can't really use the full effectiveness of the product itself. So that's why we're trying to make it as convenient as possible, make it as hassle-free as possible.
All right, thank you, Darren, again for the response. I think we can move on to the next question from Dr. Jasmine. Could you elaborate on the technical superiority that supports your solution without a wearable sensor?
Hi, my name is Case Young, so I'll just be addressing his question. So thank you, Dr. Chiu. I think Darren has already suggested a lot of the advantages that having non-wearable technology has on the convenience and compliance that patients will have with regards to the use of this device. But also I'd like to expound more on the technical aspects of our device because it uses a sensor, and this sensor uses both an RGB camera and also a depth sensor camera. Is able to track the movements in real time. And the thing about the time of flight sensor is that it's able to, compared to other sensors like a stereo vision sensor, or triangulation systems, it's able to process the data very quickly. So what this allows is a real-time tracking. So we feel like this is an adequate adjunct to any wearable technology while also giving the advantages of boosted compliance. I'd like to pass over to Sean to continue my response.
Yeah, okay, thank you, Kei Xiang. So perhaps I would like to also sort of concede here that because we're a bunch of medical students, we may lack the technical specifics of which we need to onboard a technical partner subsequently. However, the intention behind the concept of our product is to focus on the milder spectrum of osteoarthritis, in this case, the preventive aspect of it. So in this case, because of this, we will just need the technology to focus on the postural errors which the camera can pick up even without superior technologies. And what we found more important was it's a trade-off, right? Because if you want the cutting-edge technology, you may need an actual wearable knee sensor, but then that sort of like does not take into account our target population, which is elderly, who may find it extremely cumbersome to put it on and off all the time. So because of that, our idea is for AI technology to be like a proxy where it can help in the management of OA patients for the milder cases, of which when it escalates to a more severe case requiring special intervention, the AI will prompt the elderly to refer on to a physiotherapist or orthopedic surgeon accordingly. So we're not removing that professional input here, but we want to focus on the preventive aspect of OA care. Hope that answers your question.
Okay, so maybe I can add in just a bit more. Okay, so thanks, Sean, for adding on. So in terms of like the technical superiority of like having not having a wearable sensor, I think one of the things that we can consider is the fact that we actually not because our sensor is basically just placed in front of the television. So versus like if we were to use a wearable sensor, that's actually subjected to a lot more wear and tear, and therefore there might be higher maintenance fee that comes from it as well.
All right. Thank you, Sean, Darren, and Kei Xiang for the very comprehensive response. Perhaps we can give our judges a few more minutes to deliver more questions. And meanwhile, if any of your teammates would like to add anything on, please feel free to do so as well.
Yeah, in the meantime, perhaps I think Megan sends the link to our app in case some of the judges are still having some difficulty to see our prototype. Yeah. While we wait for the questions.
All right, I think we have a question from Dr. Mary. Could you share a demo of your app?
Okay. Yeah. Give me a moment. Wait, let me just stop presenting for a while. Let me just try out because I don't think we incorporated the demonstration of the app into our presentation because it was meant for the QR code to be flashed. So, sorry. Okay, I think, yeah, let me just share screen again. Yes. Yeah, so perhaps I can just show you this is the basic interface of our app, and perhaps later Megan might want to come in on this because, yeah, she was focused on that development as well. Yeah, so here we have the main page for the OActive app. I think what we want to bring your attention to is the simplified layout of the app. The user interface is kept simple because we bore the elderly, which is our target group, in mind when it comes to using such technology. So upon coming to the main page of the app, you just need to click Start Exercise. And from there will be a list of exercises today to be done. So if I were to click, so after that, yeah, so the exercise in progress. And if they complete exercises, they'll earn points. So when they earn points, after the exercise, the AI will also have an option here to check if our elderly patient is experiencing pain, because that's sort of a red flag to seek professional input. We do recognize the limitations of our AI technology that we cannot we cannot quantify subjective experiences like pain as well. So if the patient experiences pain, we might refer them to seek specialist input. So if we were to go to see the point system, these points would then enable Madam Tan to exchange coupons, such as like the Healthy 365 initiative, like National Steps Challenge as well. So when you click exchange for coupons, we can see there are a range of partners here, such as Fair Price, major firms like Guardian and Watsons as well. Yeah.
So hi, I think I can add on to that as well. I think if you go back to the main menu, you can also see that there's an option to view videos, which is targeted towards public education. So if we did mention that there's an OActive Plus and there's the OActive free version. So for the OActive free version, the videos are free for anybody to view without paying the $10 per month subscription fee. So these videos, using on my phone right now. So you can actually we'll be using videos that are produced by probably the ministry, so that it's all accurate content. And so these are the main two buttons that the elderly will have to press. So the other buttons are more for when they are first setting up, and if they need a caregiver or if they do need any technical support, we can try our best to help them to do the setting up, so that when they start to use it alone at home, they just need to press the two buttons above. So as you also mentioned just now in the presentation, that there's also other language options that you can click on, and you can also view the report after clicking on the report button as well, if you do pay $10 per month.
All right. The team, is there anything you would like to add on?
Yeah, I think not at the moment. I think we shared what we intended to share. So perhaps we'll just wait for any more questions to come in, and we'll gladly take them. Yeah. And okay, maybe for some reference, sorry, can you still see my slide just to double check?
Yep, we can.
Okay, great. Maybe I'll just reference the judges to this slide as well. Yeah, in case we're just trying to like understand the holistic totality of our app. So this is the layout of our app and the difference between the free version, the app that's available for free download, the sensor, and our OActive Plus model. So this is what we intend to market.
Yeah, perhaps Sean, what you're showing is actually related to a question from Dr. Mary that she just posted. I will be showing her question. Yeah, so is there a difference in pricing for the hardware and the app?
Okay, sure. Yeah, Angeline, would you like to take the question?
Yes, maybe I'll take this question. Thank you, Sean, and thank you, Dr. Mary, for the question. So maybe, Sean, could you share the slide on full screen?
Sure.
Yes. So as you can tell from this diagram, the basic OActive app is free for all users. So we operate on a freemium model, and users who download the app will only have access to educational videos and a list of exercises, as what Megan has shown just now. However, to maximize the OActive experience, it is recommended that they get the sensor, which is priced at $299. If they get the sensor, they'll be highly encouraged to get OActive Plus, which is $10 a month for a subscription, and it enables them to gain access to all our features. So as you can see in the diagram, this OActive Plus feature includes constant updates and premium exercises and a personalized report generated by our system, which enables the PTs to track the progress of our patients and to make the necessary recommendations. Yeah, so as you can see from the diagram, should patients get the sensor, it is most preferable that they get OActive Plus to benefit from the full suite of services that we have. Yeah.
And perhaps to expand on Angeline's point, I think when we do encourage our patients to get OActive Plus, the customers, for two main benefits. They actually do get two forms of benefits. One is it enables them to, because of the sensor, to claim vouchers and points, right? Which in a way will help to compensate some of the initial upfront costs. The second one is basically what we aim to do is to reduce that kind of frequency of spending when it comes to like your weekly physiotherapy session. Because the thing about osteoarthritis from a clinical perspective, it ranges from a spectrum. So for the milder cases, we might not need to actually have them see the in-person physio as often as perhaps they currently are. So this will actually help them in cost saving as well, and also the cost of transportation, the inconvenience of traveling to and fro, and that is our value proposition. Hope that answers your question.
All right. Thank you for the response. We have one last question from Mr. Teo. I've been brought that on stage, but the team, please be reminded of your time and keep your answers short and sweet.
Okay, I will take this question really quickly. Thank you, Mr. Teo, for the question. So the provisional patent would allow us to secure early filing date for our invention and for 12 months. So in the meantime, the patent will not be filed yet, but it allows us to assess the commercial viability of our product. So as we mentioned earlier, we'll be conducting trials and assessing whether our product meets the needs of our target group and how we can make it more commercially viable. So we will file the patent first to ensure that our product idea does not get stolen in the future, and only so we have 12 months to decide whether we would like to grant the, whether we would like to file a full patent. So IPOS will hold our patent application, and once it is filed, it will be backdated to the initial date where we applied for the provisional patent. And from there, we can secure our intellectual property rights to our product. Yes. 12 months might seem a bit long, but there's this AI2 scheme by IPOS where it can
sorry,
accelerate.
Angeline, I'll have to cut you here. Sorry about that. But the time is up. Yeah, so thank you, team, for your presentation Q&A, and also thank you, judges, for your questions. For the team, Mr. Lai will actually have some comments for you guys in the Q&A function, so please take a look as well. So now I'll pass the time to Wei Jian to jump on to the next segment.
Yep, thank you, Suji, and thank you, team, for presenting. I think it was pretty insightful as well, and hope you all had fun. So we'll now transit to the next team, and I'll kindly invite you off the stage. And for the next team, we'll actually break for a really short one, for 2 minutes, roughly there, and we'll come back at 3:27. Yep. So just be ready, and we'll invite you shortly.